There's been an increase in COVID-19 infections among children in Sweden. The Swedish Public Health Agency says the rise could be linked to a recent increase in testing. Among the elderly, there was a clear drop in new reported cases, which the agency believes is largely due to the impact of the vaccination rollout. Well, Per Bergfors-Nyberg is in Stockholm for us. He joins me now. Per, so tell us more about the rise in the number of infections amongst young people in Sweden.
Well, good morning, Alistair. Basically, this is an age group that spend a lot of time together, and according to the Swedish Public Health Agency, they don't think that they necessarily observe the different restrictions all that well. Plus, this increased testing that you were talking about, now they're not just testing individuals, they're testing entire school groups, entire school classes to make sure that no one sort of falls through the cracks. Plus, the situation in Sweden is quite severe. Sweden actually has one of the highest number of new infections across Europe, and it's mainly because we now have the British variant, which is the dominant one here. Over 1 million confirmed cases, more than 14,000 dead. But, Alistair, the authorities believe that they might see sort of a brightening coming up, because just last week we had 11% of those who tested were positive. The week before that it was 12%, so they're hoping for a downward turn now. And the key now is vaccinations. So far, a third of all adults have had at least one shot, and they're saying that vaccinations are actually highly effective among those people living in care homes. 89% have had their vaccine, and they're not seeing a third wave there. So we heard from the Swedish health minister urging people to at least get the vaccine when they're offered. Take a listen.
A completed vaccination reduces the risk of death and of serious disease. Our society is not safe until there are a lot of us who have been vaccinated. We must remember to get vaccinated is an act of solidarity. It protects both you and your surrounding from COVID-19, and every vaccination helps to reduce the pressure on the hospitals.
Two different scenarios, likely scenarios where things could move on from here. They've studied what's been happening in the UK and Israel, where they've moved much further ahead in their vaccination campaign. And they're saying the most likely scenario is that people will continue to observe the restrictions, and hopefully the vaccinations will also move ahead. And if that's the case, things could actually look quite good in the summer. Take a listen.
If we are to succeed in reducing new infections, then it won't be enough with just the vaccines. We must all continue to limit our contacts with people, maintain social distancing, and follow the recommendations. And say yes when we are offered to get vaccinated. If we do all of this, then our agency's assessment is that this massive epidemic will fizzle out during the summer months.
And the hope there, Alistair, is that within the next couple of months, Sweden and the rest of the EU will also start to vaccinate people as young as 16, possibly 12, but they're looking for the EMA to make that kind of call.